Hello, hello.
Hey, let me pause this real quick. Have the recording going. All right. Thank you, everybody, for your patience. We're waiting for a couple more people to come in. How's everybody doing today? Feel free to
In a weird way, like if you look quick from far away. Who's so quick?
something in the chat.
Jeez, I forgot today was Tuesday. Holy Jesus.
Okay, I'm gonna mute. Hi, Lynn. I am also doing well. Charlotte, how's your day going today?
Good, good.
We have Andrea on and Amelia. Hey, Robin. I hope you're doing well. Hope you can hear us fine. It's good to have you on. How's everything going? It's been a couple weeks since I've talked with you.
I'm a little disappointed because I have not received my supplements yet, and I feel like I'm waiting a long time.
Supplements or your
My
pharmaceuticals?
pharmaceuticals.
Hmm. I will let Allison know. Hi, Jasmine. I think you are a new face here. How are you doing?
I'm good, thank you. How are you?
Doing good. I'm Justin. I run the Hormone Happy Hour. Are you a potential client or a new client?
I joined, I think, in November, but I travel around the globe, so there's just been a lot of postponing. So I'm here now.
Well, it's great to have you. Where are you located?
I'm in Mexico. I'm in Mexico now.
Okay. We got a couple more people coming in and then we will start rolling. Robin, I'm gonna send a note to Allison right now to check on your medication order.
Yeah, I know she's tracking it. She told me last week that she'd be tracking.
Andrea, can you hear us?
Yes.
How are you? It's been a couple weeks since you've been on and since I've talked to you. How's everything going?
A little better. I started the testosterone about 5 days ago, and I seem to have a little bit more energy. But I have to be more careful to pace myself now
Yeah,
because even though I have a bit more energy, when I do too much, I still crash.
I understand that completely. Well, that's a positive. Was your
Hmm.
doctor there local willing to do that for you?
That was absolutely no problem. Um, she agreed that this might help.
That's wonderful. Yeah, I think that's
It's just
help.
just the dosing is a bit annoying. It's that half liquid gel in a bag that I have to divide into 10, like even kind of it's they don't obviously have a small female size of hormone.
I have another lady I'm working with in Poland, and it's a similar process there. There's not
Yeah,
compounded options, so you're stuck with a commercial grade product, but something is better than nothing. So I'm happy to hear that. I'm glad that she was willing to do that for you.
exactly.
So
Yeah, and she's going to measure the level in a bit less than 2 months.
gotcha. How's everything going with your GI protocol? Things working pretty good? Are you feeling better?
That's working pretty good. I had no problem with the berberine at all. So I'm now on like twice 500 microgram. Um, yeah, it's my last week with the treatment, and then I can start rebuild my gut.
That's great. No, I'm happy to hear that. So we have some new faces on. We have myself, Coach Charlotte, and Sophie here on the call. Is there any questions that we can answer for current clients or potential new clients? Feel free to pick our brain. We would love to talk to you.
I'm wondering if anybody knows of anything that I could take to relieve severe neuropathy in my feet due to compressed nerves before my spinal surgery.
Did Allison talk to you potentially about BPC 157 or NAD plus for the neuropathy?
I think she did talk about NAD plus.
That's probably a good avenue to look at for regenerating nerve. I know injectable BPC 157, that's something one of the compounding pharmacies formulate, and that is what I've seen the most success with neuropathy. If that's nerve compression or diabetic neuropathy, I see regeneration happening pretty, oh, I wouldn't say pretty quick, but within a couple months, you could see some changes there. When is your spinal surgery?
I had it in November and then another one in December.
I knew you had one previously, so you're coming up on another one here in about 6 months.
No, I had the surgeries.
Okay. Yeah, I knew that you had one. I didn't realize that you had two.
I had two within a month and a half of each other.
Yeah, I'm assuming you're doing physical therapy and other things on top of that?
Mm-hmm.
Yeah, I think the BPC 157 is something that in the injectable preparation would probably be pretty beneficial for you. Reason I asked you about the physical therapy because I think you need kind of a couple layers to help with that. I think the physical therapy on top of some regenerative peptides probably would be very helpful for you.
Well, I've been doing physical therapy, and actually, a lot of the protocols I do in physical therapy, I've already been doing for 2 years, and it doesn't really relieve the sensations.
Yeah, I think that from a pharmaceutical standpoint, what type of things are they having you do? Are you doing consistently in physical therapy?
I do a lot of things that stretch my calf muscles. I walk on my toes. I stand up straight without assistance from a chair. I walk trying to put one foot in front of another because I'm also trying to improve my gait. I walk sideways. Um, I get massages on my feet. I do things, I can't remember the name of it, where I'm lying down and I have my leg bent and I'm pressing down to sort of release contraction in my hips.
Yes.
So I
Um,
think they're all of the standard exercises.
yeah, I would say you're probably covering most things from physical therapy standpoint. I would say looking at some of the other therapies. I think also not just for nerve endings, but just for like joint integrity and just like general inflammation, us being able to reduce that for you. That's a lot of that's going to be nutrition and lifestyle based, but coupled with therapy. If that's peptide therapies on top of physical therapy, would be some of the things I think would be super beneficial. Um, Charlotte, do you have any input on that? I'm not sure if you have any clients you've worked with neuropathy.
The only one thing that you already named was just the like pharmaceutical grade peptide to lower the inflammation and to help restore, restructure, and rebuild, right? I think I've heard of that working really well for people after recovery of surgeries. So again, it's never too late to try something like that to continue to expedite the trauma and the inflammation that happens after surgery, right? So on top of a really good diet and lifestyle, I think that would be the one thing that I was thinking of.
Thank
I since I have not started with the progesterone, estrogen, and testosterone, I don't want to start taking a whole lot of things all at once. So I'm waiting to start with the pharmaceuticals that I already ordered and get an experience of several weeks to see how that shifts my condition first. Because I think after my surgery, I got overloaded with all kinds of pharmaceuticals for pain and muscle relaxers, and I think my body was very confused.
Sure.
So I've stopped taking gabapentin because it was just, I didn't see that it was helping. And so I want to just in stages get a sense of what's going on because I don't have a good, clear understanding of what my body is experiencing and how I'm attached to the sensations that I experience.
I think that's very valid and makes sense. There is some clinical data on progesterone and nerve as well. So I think that being able to get your hormones to an adequate status and then potentially layering in other therapies once you get your baseline makes the most sense for you. I'm always an advocate of low and slow so you know what is working. What I'm going to do for you and anybody on this call, if you're interested in it, I'm going to drop this. There's some clinical data on BPC 157. If you want to just open that up and look at it later, it's here in the chat. I think a lot of this, and let me double check this. Yeah, so it'll talk about gastrointestinal healing, lesion, tendon, ligament, muscle, bone. And then this is going to bleed into nerve as well. There was some data done on this. This is fairly old, but from 2018, but people are still um, using BPC. It's probably one of the most tried and true. I would say peptides are still in the infancy stage of medicine. If we look at things like antibiotics, they've been around so much longer, but I do see a lot of promise with peptides for a host of issues, BPC specifically, muscle, ligament, tendon, nerve, and here's some good clinical literature to support that.
I'm completely new to this conversation. I'm only hearing about peptides outside of skincare right now for healing. I have numerous injuries that have lasted years and years and years that have impeded my ability to train as effectively as I used to. As I'm even sitting here during this meeting, I'm in excruciating pain from my SI injury that I had in 2016. So with an injury that old, would you think that peptide injections could help?
Yeah, I would say so. The thing I think about is uh, these peptides create something called angiogenesis, so just increased blood supply to ligament and tendon. So I think that ligament and tendons tend to not get adequate blood supply like muscle fiber does, so they tend to take a long time to heal or they don't heal.
Okay.
I do think that it would still be beneficial. The only time I don't think BPC 157 is beneficial if someone is bone on bone. So if they have no cartilage in their knee, for an example, you're
Right.
not going to have any symptom relief with that because there's nothing left to regenerate. But outside of that, yeah, I would say there's several of them that are quite helpful. Um, Someone else put in here NMM, so the nicotinamide mononucleotide precursor. That's similar to NAD. Yeah, I kind of goes into Robin's question about nerve and regeneration of mitochondria. I think all of those things are great, but specifically for you, Jasmine, uh, this BPC 157, we will put this in the chat for replay. The documents should load in there. I'm going to send this over. If you want to sit and look at that at some point, I would highly suggest that. You can also, I know a lot of people like TikTok and Instagram. You can type it in there, and there's going to be hundreds of people talking about these peptides. I've been using peptides since I think like 2011. BPC is something that I'm a big advocate of and use on a regular basis. I have a torn labrum and I just refuse to get it cut open. So it's something that I'm using throughout the year, 1 to 2 times a year, just to kind of keep things structurally in place. So I think it would be helpful for you.
So is this an IV? Um,
So depending, what we do with our telemedicine service is actually a lyophilized powder that you mix and inject subcutaneous. There are clinics that are doing stem cells that I know do IVs of BPC. It just depends if you're doing like an in-person setting versus a remote setting. Both options work pretty well. The IV therapy is a little bit more expensive, but quite helpful. I had a client, and I'm not sure where in Mexico. She just went to get stem cells, and she did IV BPC. She did IV NAD and a couple other peptides and had a lot of relief. She had some structural issues with her feet.
right. Yeah, I have an issue. I covered in ink, but I have an issue with those kinds of needles, which are medical needles, very different from getting tattooed. So IV for me wouldn't be an option, but if it was just an injection a few times a year, I think I could probably do that.
Yeah, and you're probably looking, because I use all this stuff, so I have needles here at my house. You're looking at a very small insulin needle, so you almost would not feel
Oh,
something like that.
yeah, that's great. Yeah,
It's not a large hypodermic needle that I think a lot of people associate injections with. So it's
right.
much smaller. It's very non-invasive, but very helpful.
And what would I go to a sports medicine facility? Can I go to I mean, what sort of doctor am I going to or clinic am I going to receive these injections?
So if you're in Mexico, we're going to want to find a like anti-aging or functional medicine clinic. I'm sure there are physical therapists and other things in Mexico offering services like that. It's a little different than the US. You probably can find a place doing all in one. So someone's doing physical therapy on top of peptide therapies. They're becoming much more recognized. Um, the other thing is using things like these other peptides we're talking about, a lot of them have synergy together. So I would just probably type it in search engine in your area and see what's available. I'm sure there's something available in your area.
Uh, I don't mean to dominate the conversation in any way.
No, go ahead.
I also have calcification on both my wrists. Is there anything outside of having it shaved off the bone that I could look into that's regenerative?
That's a really good question. You know, I'm not 100% sure on the calcification issue with the wrist. Do you have, were they broken at some point and then through like a healing process, or how
They
did
were
that?
badly injured during kickboxing, taking kicks for years and years and years, and just fighting in general. Not street fighting, but
Sure,
fighting. Um, and just they're really small wrists, and it didn't take a lot, but years and years and years of wear and tear. It just formed over a period of time,
sure,
and it's been so it happened at the beginning of COVID that it was very notable. So, I mean, I don't have any integrity left. I don't have strength really left in my both my hands, so that complicates me lifting. I've had to be very, very creative. I do so very humbly now, but I have to spread out my day so that my hands can sustain the day. And it's a constant pain. I'm always in pain.
no, that makes sense.
Alleviating that would be ideal, but having calcification shaved off of your bone in both your hands almost doesn't seem feasible for a period of time that the recovery would take, right?
Yeah, the only thing I'm aware of for calcification, and they're using that more specifically in like small vascular systems, is acoustic therapy. That seems to be something to break up calcification, but we're using that. You see that more in the men's health and specifically like ED. There's lots of small vascular system in male genitalia, so that is
Sure.
used to break up calcification. I'm not sure if there's cross-reference into bone just because it's so much larger, but that's the only thing I'm really aware of right now.
Okay. Thank you.
Absolutely, yeah. Um, we had a couple more people join. Does anybody have any questions for us? I see, yeah, Tanya dropped something in here. There's lots of research from David Sinclair on NAD. Dr. Sinclair's great. I would recommend anybody listening, watching this, um, great website. You could pull up social media. NAD is one of my favorite peptides for mitochondria, nerve ending. Um, we'll see more of this become relevant in the next 5 to 10 years. Peptides have really grown in popularity and they've been around for quite some time.
Justin, do you know of any positive effects that can be gotten from vitamin B12 in regards to nerve regeneration?
If you're deficient in B vitamins, absolutely. So, tingling hands, neuropathy, tingling feet. Usually, I like a methylated B vitamin. So, if you're looking at doing an oral formation, you have cytocobalamin, that's a synthetic B vitamin. Methylcobalamin is the active form. We tend to be able to metabolize and utilize that one better. I think really what I would look at is seeing if someone is deficient in that. Most practitioners would look at a B12 serum. I actually like to look at something called methylmalonic acid. It's just MMA for short. And that shows tissue-specific sensitivity to B vitamins. So if you are deficient in Bs and you do have neuropathy, it is a potential avenue for you. But you probably would want to see what that status looks like. I use injectable B vitamins from time to time, and I take B vitamins because I don't have MTHFR. It's a genetic mutation where I need a lot of methyl donors and B vitamins, but I tend to have some issues around that. And B vitamins are quite helpful for me. I think a lot of people can benefit from them. They tend to be pretty safe, but I would get an active form of B if I were going to use something like that.
When you say an active form of B, what do you mean?
It will be specifically methylcobalamin. If you want to look at a product, Robin, so you don't have to just like search a bunch of places, homocysteine supreme. The coaches know I love homocysteine supreme. If people are low in B vitamins, I usually always recommend that product because it's really high quality. That's one of my favorites. There's injectable preparations, but again, I think oral is probably easier for adherence.
Thank you.
Absolutely.
Hello, I'm not sure that you can hear me.
I
Can
can
you?
hear you. Yes.
Okay. Hi, everyone. My name is Donna. I'm new here. I happen to be blessed with the MTHFR deficiency, the 677T to be exact. Both genes are deficient. And it's never really bothered me my whole life until 1 year ago, where I had diverticulitis. And as a result of that, I had major extensive testing done with a functional medicine doctor and found out that I have a very high sensitivity to gluten and wheat. So I've eliminated all of that from my diet. And I gained 18 pounds in the process, which makes no sense to me. Most people stop eating bread and they lose weight. Me, I stop bread, pasta, all kinds of things that are fattening, and I gain weight. And I'm having an issue losing it because I can't seem to eliminate these bad toxins that are somehow lodged within my intestinal tract there. Um, the functional medicine doctor recommended so many different supplements that I did try, and I'm still not what I consider to be my healthy self. So it's 1 year that I'm toying with all of this, trying to get to the bottom, trying to get back to the proper digestion, and I just cannot seem to do it. I just had a conversation with Davey, who suggested I come and listen to all of you. And as far as peptides, the word is kind of new to me, but is that like glutathione and berberine, and like what are peptides and how do they or can they aid in digestion?
Yeah, it's a really good question. I want to talk about the peptides, and then I'm going to pass the detox over to Charlotte because she's our expert on that.
Okay.
Um, when we talk about peptides, peptides are naturally occurring. Glutathione is most definitely a peptide. It's a three amino acid sequence that makes up glutathione. All peptides are basically amino acid sequences. They are synthetically made in a lab.
Mm,
Um, and basically, these are structured a certain way to cause gene expression in your body. So, one I was talking about earlier is injectable BPC 157. Um, in the chat, I had dropped a document on BPC 157, and they're looking at it for oral for gastric lesions and DVT as well. So that
mm,
would be something to think about. A lot of times with leaky gut and food allergies, you tend to have issues with the mucosal layer in your stomach.
mm,
I refer to that very similar to like the lining in your mouth. That becomes kind of separated and torn. And if you've ever bit your lip or had a rough spot in your gums, how food and things will hit that and it will react, and you'll have a like an inflammation response. It may get red and bleed. Your
mhm,
stomach's that same way.
mhm,
So you're going to want to think about increasing that. Peptides like BPC 157, they are native to your digestive tract. So you actually make small amounts of BPC there. This just goes in and basically increases blood supply to the intestinal lining, the stomach lining, and helps beef it up. So you're able to separate things from the digestive tract from the bloodstream. So a lot of the food sensitivities and allergies are an immune response due to leaky gut. BPC is a one way to do that. There's a lot of things naturally that work as well. Adequate fiber, glutamine, zinc carnosine. There's several things to help with that. But if you have issues with leaky gut, potentially having more pathogens in your body, more toxins, if you have a sluggish COMT or methylation pathway from a MTHFR mutation, those toxins are not able to clear effectively. Usually that's through the intestine. So having leaky gut or some sort of colitis, Crohn's, DVT, those things are going to exacerbate those symptoms. So I would think about looking at it from a nutritional supplementation, potential pharmaceutical, and then detox once those things are healed. And I want Charlotte to talk about that if she would.
I thank you.
So I could even back up a little further to Robin and Jasmine and then connect it back to Donna as far as like why the liver is so important in this case. And then of course the gut is very important too. But just to back up just a hair, when we talk about calcification in the bones, usually that starts from a sluggish liver because then the liver produces less glutathione, which would promote systemic inflammation and calcification. And that calcification is then put into the soft tissue is probably where a lot of trauma goes, right? So if you're a fighter working out, your bones are your joints are taking a lot of hit. So it's gonna store there most likely. So if the calcium isn't deposited in the bones properly because of poor liver function, then it'll accumulate in your wrists. And then the paradox is, of course, osteoporosis, calcification, and then which is just literally dysregulated calcium metabolization. That's what it ends up to. And then vitamin K2 is really important here too because it activates, um, it's a sciencey word, osteocalcin, that's the direct calcium into bones and away from the arteries and the soft tissue. So if we can all work on it, it comes back around to even B vitamins. A lot of those are metabolized in the intestinal tract, small intestine, but a lot of the work is done in the liver. So if your liver gets sluggish, you're going to have a lot of deficiencies in B vitamins. Even taking supplementation, while it does help to a certain extent, once you go off of it, then why? You kind of go back to where your baseline over time. It doesn't happen overnight. It can happen over time. Again, these deficiencies show up. So getting into liver detox is super, super important just to make sure all things are functioning well. If you have, diverticulitis, the bile from the liver is such a huge, I would call dishwater detergent soap, cleaning out the small and large, small intestine to make sure that it's balancing good and bad bacteria. Once that bile is slowed down significantly, then we have a lot of gut bad bacteria proliferation. We end up with a lot of things. Food can obviously do this too. Um, from food can tear up the digestive tract in huge ways. So it's a conglomeration of a lot of things from lifestyle piece. But if we can go back in and help our drainage pathways by cleansing them over time, this is not like a one and done thing. This is over time, slowly, methodically, go with your body's rhythms on top of all the foundational things we teach in this program, which is food, lifestyle, rest and digest, stress management, quality water, eliminating all the chemicals and toxic things in our household. That's going to help the detox process a lot, and then the body can now start to heal. I think collagen peptides come in so amazingly because we are in kind of an age where we have really tough inflammation issues we're dealing with. So I think that's where the peptides really shine when it takes way too long and you can't even detox at that point because you're just reacting to everything. Everything you try, you react to, and it just doesn't cut the mold. And then you're trying to, every little supplement doesn't work. But the peptides I've seen from a lot of people, really great results, and to help get you to a position where you can detox and you can feel better if you're dealing with diverticulitis, especially. That's one that would benefit greatly, I think.
You have some
Okay, thank you.
application with a couple clients, right? We've worked through, I'm not going to say any names, but pretty severe case of Crohn's, correct? And with the implementation of BPC, some pretty drastic improvements of gaining weight and be able to eat food. Can you talk a little bit about that and, maybe what she was dealing with initially and what type of improvements you've seen over a course of time using that peptide?
Yeah, she really couldn't eat much food. Gained a lot of her weight in the central belly area. Very lean everywhere else, but just a lot of, I guess, inflammation. I would say water retention more than anything. So once she started the peptides, and she was slowly starting to eat more and feel better once she cut out like dairy, gluten, and all those things. Um, but as soon as she ate one or two little things, she was set back. The fire was again started in her gut. Once she started the collagen peptides, she felt immediately within the first week. Now, this is different for everyone. This was just her case scenario. She felt in the first week that I just feel better. I know it because, once you're in that inflammatory state, you're very sensitive to how you feel. You know when something works, when it doesn't work, when it sets you off. So she was able to instantaneously, I saw it in her log, just eat more and be hungry for more. So that was really great for her. And that was kind of the big goal because she was sitting at 1,200 calories or below for like 2 or 3 years or more, like ever since she dealt with Crohn's. So it was a game changer for her for the BP 157.
Yeah, I love to hear that. That's so great. I'm glad that we were able to help her.
Mhm.
Donna, do you
So
have
is
any
this,
other
sorry,
questions?
is this BP 57 something that you prescribe through your HRT program, or is this something we do
Yes.
independently?
Yeah, it's included. You have to have a US resident or a residence in the US to ship to. But yes, we through telemedicine platform, you're able to get a prescription for injectable or oral BPC that shows up directly to you, and then you're able to administer something like that.
So I'm having comprehensive blood work done uh, in about a month. And the reason I'm doing it here, so I'm Canadian, and the reason I'm doing it here in Mexico is because they'll gas me here and do it, and I can't do it otherwise. And they won't gas me in Canada. So, I mean, and I live here. So I'm going to have that done. But would that qualify? I know that you have your own blood work and your own labs that you send your work off to, but if I'm only able to have my blood taken this way,
I think
is
so.
that still,
You need to
yeah?
send it to us. Who's your coach?
Sophia.
Okay. Uh, we can work together with Sophie and get that information, look over it. Peptides really require less comprehensive blood work than hormone replacement therapy. It's a much more comprehensive panel. Send it to us and let us look at it. If you give it to Sophie, I'll review it with you. And then from there, we can send that over to medical team for them to be able to look at that. But yeah, I would think so. It would not be a problem. The only thing is you would need to be in US to be able to receive that product.
So even if you prescribe it for me, I couldn't have that prescription filled in Canada?
So all the compounding pharmacies are in the United States. I don't believe Canada even has very many compounding pharmacies that make BPC. I have several Canadian patients.
Okay.
So you would have to have a product made or a prescription made in the US. You can't ship internationally or over lines. There's legal reasons behind that. I'm not a lawyer, so I don't know the specifics on that. But I know you can't get medication out of the US into Canada unless someone were we have several clients who have residents in the US. They may fly there, pick up their medications. You're able to travel with them. They're a prescription for you. You just can't ship them from a pharmacy into Canada or to Mexico.
Understood. Okay. Now, is there a specific, so with the hormone, with the HRT, is there a very specific template of the kind of blood work that needs to get done? I would assume so. And do I need to be aware of that when I'm asking to have that included in my blood work?
I'm sure we have a template of that. Coach Sophie's here on the call. We will, I'm going to put a note right now to get you a list of,
We have the past requisition form, so if anything, looking at that, that basically is the template of it.
That'd
yeah,
be perfect. Yeah.
can we send that over to Jasmine?
Yeah, absolutely. I'll send that to you, Jasmine.
Perfect. Thanks, love.
Of course.
Yeah, I think that would be great. What else? I had somebody else raise their hand. Robin?
Yeah, that was me. I'm new here. Thanks for having me on. You were
Yes.
talking about peptides, and I've been going back and forth looking at one that I was interested in trying because I've had a weird appetite thing for like 15 years. It started probably when I was perimenopausal, and now I'm postmenopausal, but I had never had an appetite issue for my whole life. And now, it's just constant. I could eat a big plate of food, and I've seen many doctors for it, and I just have a lack of satiation. So the only thing that hit it was last year, my naturopathic doctor had me start on oxytocin nasal spray, and it was like amazing. I mean, I felt like life was brand new again. It took all that food noise away, and but it only lasted for like 2.5 months, and so and then it stopped, and they said, "Well, go off of it because your receptors are probably I don't know what they call it, anyway, becoming intolerant." So I did a small microdose cycle of tirzepatide, like 1.1 milligram, I think was the highest I got I did a 3-month cycle. I didn't really love it because it did work with the food noise, and I wasn't doing it for weight loss as much as I was just doing it so that I wasn't so hungry all the time. But at the end, I felt I had that kind of a lack of motivation. So I cycled off that, hoping to cycle back on the oxytocin and have the help, and it did not work. It didn't hit me like it did last year and really have the effect. So I've still been struggling. And so I keep looking at this peptide to potentially cycle, which is called tesofensine.
I was just going to
But
say,
I'm scared. I'm scared of it because as I read about it, it makes me think that it's like an antidepressant. And I'm like, I'm not depressed. I don't want to, I'm scared. So I just wanted to get your feedback and your read on that particular peptide because it seems quite different from some of the others. And because of that, they say that it's the reuptake inhibitor. And so sorry for the long background, but
background is helpful. No, I appreciate that.
yeah.
So I like to look at maybe laying some groundwork initially. Things that I'm sure you've been tested for, looking at things like leptin. You may have leptin resistance. I don't know if that's ever been tossed around for you.
I have had my leptin levels tested. They were they weren't high. They weren't low. I can't remember. They were just, yes, I have had that test. I've had a lot of blood work over the years.
When I think of potential leptin and ghrelin, so that's your satiation hormone
Hmm.
versus your hunger hormone. Uh, so circadian rhythm is probably something, if you're not doing, I would think about, and I'll get to the peptides. I'd love to talk to you about that. But things that I think from a maybe a lifestyle standpoint, wake and sleep cycles are what regulates your hunger hormones. So when I'm working with somebody who may have not just hungry, but maybe an irregular appetite, hungry at weird times, I really want to focus and dial in that stress response. So cortisol is an appropriate stress response to get us up out of bed and get us moving, versus, a lot of times people have some abnormalities with that, which can cause issues with hunger hormones. Um, when we look at things like oxytocin, it's given for a whole host of things. I see it for osteoporosis, I see it for anxiety, depression, PMS symptoms, just for bonding, maybe is something else it's given. So I think that maybe the overuse of that could definitely cause some downregulation in receptors. When we get into the classification of GLP-1 agonists, trizepatide, semaglutide, retatrutide, I don't dislike or like those drugs. I think application for everything. They can do an okay job of reducing food noise, but I tend to see them cause issues maybe with lethargy or maybe even nutrient deficiency or muscle loss if we're not using them in appropriate setting. Tesofensine is really interesting. So it's a triple mono reuptake inhibitor working off of norepinephrine, epinephrine, and dopamine. What I see, because I've used it several times, is potentially that increase of dopamine really helping with appetite suppression. I think a lot of us like that dopamine reward, or we not maybe not like it, but we're fixated on, hey, when I eat this, I get a reward sensation from that food. I feel satiated. I feel happy. That drug basically increases dopamine. So it will give you some of that same sensation, which does seem to suppress your appetite. Really, the things that worry me about tesofensine for some people is you can't take MAO inhibitors, you can't take SSRIs, SNRIs, because all of those things are going to work on neurochemistry. I do think that at small doses it can be effective. The other piece is blood pressure issues. So if somebody is pre-hypertensive, we probably don't want to use that. But outside of that, I think it probably could be put in strategically with other things to help manage your hunger. Also working on that wake and sleep cycle, stress management. Those are all things that I think of. I wanted to see if the coaches had any input on potential hunger regulation, um, things that may kind of fit within Robin's scenario.
Well, I have a question. Like, is there anything you particularly feel like you crave, or you're just, no matter if you eat a ton of protein, you're like, I'm still hungry, or is it certain things that you feel insatiable about?
No, there's nothing specific. I mean, I get close to 150 grams of protein a day right
Right.
now, so I'm definitely hitting my macros. Um, I eat a good amount of carbs, like, 190. Um, I when I went back on HRT, my blood sugar was kind of going a little bit on the higher side, and my insulin levels were like maybe at like 6, which they had been around 2. I'd always had low insulin. So, but when I went back on the HRT, that kind of all leveled back out again. So it's not a specific food. And it's really, and you were talking about cortisol. My cortisol levels are not high. I get up every morning early to get morning sunlight, walk outside. So I've been working on my circadian patterns for the last year, I think. Um, so yeah, it's not a certain food that I'm specifically craving. It's more like I could go out to dinner, and when you're out at dinner, they serve you way more food than you're used to having. Usually it's full of fat because they use so much more fat at restaurants. And I could come home and I'm like want to eat. I'm hungry. I mean, I it's not like I'm. And then in the morning I wake up many times and I have literally growling going on in the morning first thing. So growling of my stomach, it just feels so empty. And I do eat early, I try to eat by 7:30, but I mean, I've already gone on my walk and that kind of seems when I'm exercising, I don't feel like I have any hunger when I'm exercising. And that's about the only time I'm not hungry.
So you haven't gained any weight during this process of insatiable hunger, or
Oh,
have you gained weight?
oh my gosh. Over 15. No, I'm super disciplined. So let me think. You know, up or down like 10 pounds over the course of 15 years. I probably might have been a little bit higher about 10 or 12 years ago, but I'm a very disciplined person. So it's kind of like a struggle. So
Do
right
you
now,
Oh,
go
sorry.
ahead.
Go. Nope, sorry. Go ahead. You weren't finished. Keep
I was
going.
just going to say, when I started, I used to eat a lot more low carb. And last year, when I went back on my HRT, I kind of shifted and went to doing my macros with more carbohydrate and lower fat. And I actually lost about 7 pounds over the course of 7 months, very slowly in a very low deficit. Um, but at the hunger, of course, at part of that time I was on the oxytocin, so it was real helpful. Um, and then part of that time I did the tirzepatide, but at a really low dose. And while I was on, I think I lost again. I was pretty consistent at about a pound per month and reaching my macros. And I think my deficit was very small. I was eating at that point between 1650 and 1700, and now I'm increasing my calories slowly to get up to maintenance.
Have you ever considered a parasite infection?
Oh, I've been tested for that. I've been tested for parasites. I did have last year I worked with a nutritionist on treating SIBO, and we started treating it even without having it confirmed, and then I got it confirmed because it takes so long to get the test. Um, but I did get confirmed that I did have SIBO, but it was not at a very high level, probably because I'd already been working on it with the supplements and all of that. And that's another thing that I shifted last year because I had been at one point, I was so sick of all the gas and bloating. I almost did like carnivore for a couple months just to eliminate the symptoms. But then I went back because I had my nutritionist said, you've got to diversify your microbiome. And so I did. And now I eat very, very diversified diet. And I control most of that gas and bloating now with a few supplements and a lot of enzymes.
Maybe one thing that I think it's parasites are very sneaky creatures. I mean, even if you don't see them on a GI map, they're always good. Everyone always has them. So
Mm-hmm.
I kind of half trust, I don't know if I should say this. I half trust the authenticity of seeing a parasite or not seeing a parasite on a GI map
Mm-hmm.
test. So this is where I'll say everyone should learn the art of parasite cleansing just because they are so invasive. They hide behind biofilms. Their whole thing is survival. They want to live. So if you have never tried to do one, um, it might be advantageous to try one for 3 or 4
Mm-hmm.
cycles and see if that shifts anything. But also, it's just good for the system to balance out good and bad bacteria. We're never supposed to get rid of all of them, I don't think, but when you have things like SIBO or anything where it's like you're dealing with a lot of gut issues, then we could possibly say, hey, there might be an overgrowth of something there that's creating that, right?
Mm-hmm.
And then tied to liver. Is your liver getting enough bile to balance out the small intestinal bacteria? So it's a dual fold process, but back to detox pathways, making sure everything's flowing good, doing a little bit
Hmm.
of cleansing, and try it out and see what happens. And
Do you
then
have a particular parasite cleanse that you like to use?
I like cell core. Very powerful, very good. It comes with instructions. You definitely want to work with liver and colon pathways first before going into that, because killing off parasites, they just release a bunch of junk. And if you
Yeah.
don't have a liver to process that junk and the colon is in a spotty place, do some drainage work definitely, and then go into like a 3 7 day parasite cleanse with cell core.
Hmm. Okay.
Can you add that in the chat, the name of the parasite cleanse?
Hmm.
Thank
Yeah,
you.
yeah.
I think Robin, looking at those baseline things would probably be helpful. To answer your question, I think that, tesofensine may be fine. I think you need to kind of look at medical history, current medications, potential hypertension. I don't really think anything is good nor bad. A pharmaceutical supplement, I think context is everything. But I do agree with Charlotte is what is causing that issue, and we don't want to just Band-Aid fix it. So looking at other potential avenues probably would make a lot of sense.
Yeah. Thank you so much. You did mention, I was curious when you mentioned about the tirzepatide being, you didn't dislike them, you didn't like them. I was really concerned, even doing that microdose and meeting my macros, am I losing muscle? And I was hitting my protein goals and hitting the gym hard. Um, I know that a lot of people, they undereat, and that's why they lose the muscle. Um, would you say that it's fairly safe if you are reaching your protein goals and strength training, that you're more than likely going to avoid that muscle loss?
If your hormones are adequate as well, I think
Hmm.
when we look at being able to stimulate mTOR to build muscle, testosterone, IGF-1, estrogen to a degree. Estrogen helps make IGF-1. Your hormones need to be adequate.
Yeah.
Where I see people like what you're saying having those issues, they're usually not optimized hormonally, and they're just
Hmm.
looking to, someone's 30 pounds overweight and they eat 1,000 calories. Taking them to 500 calories isn't going to fix the issue. They may lose some weight, but they're going to burn all their muscles. So I would say what you're doing from a
Yeah.
resistance standpoint, protein consumption, positive like energy balance definitely would stack the odds in your favor. I've used trizepatide. I'm a competitive bodybuilder, so keeping muscle is very important for me. But
Yeah.
I really like to control all of those variables and make sure that I'm doing all the additional work. If I'm going to use something to suppress appetite, I'm in agreement with you. Is the least amount of medication probably the best scenario? I think most people just want to get to a certain milligram because they think they may be relieved of symptoms or lose more weight. I think being hungry is a very important process within certain ranges. If you're ravenous all the time, that's a tough world to live in. I've been there after I do 16-week diet and I get the 3% body fat. I'm hungry all the time. So I understand what you're saying is it can really distract you and take away from your day-to-days. So I do think that they can be helpful. But again, I think the most important thing is figuring out why that's happening for you and then kind of working backwards. And then if you need pharmaceutical intervention, sure, but we just want to do all of the baseline stuff initially.
Hmm. I agree. Okay. Thank you so much. I really appreciate your input.
Absolutely. Well, I am thankful for all of you joining today. I have about 3 minutes before my next meeting. Is there any questions that we didn't get to? Does anybody else have anything else for us? All right. I will send this over, the replay. It'll be loaded in PT Distinction, and I hope to see you all next week. Thank you for taking some time out of your day and spending it with us. Y'all have a great day.
Thank you.
Bye.
Bye.